Good morning for everybody. Thank you for inviting me to in the symposium of the Health Law International Symposium today. I would like to talk about the regulation, some regulation relating with the law and also relating with the data that Ministry of Health have. Let me share the slide now. And I would like talking about the digital transformation of in the Ministry of Health in Indonesia to achieving interoperability through the development of integrated and standardized big data platform. Right, please. So the governance of health data and health facility is mostly not digitalized, thus decreasing productivity. It's because the manual or non-digital health service interfere with effectiveness and efficiency, and further threatening quality of public health in our working in Ministry of Health that are already going now. So the wasting on resources due to suboptimal implementation of digital technology has disastrous consequences for health facility. So we try to make this problem will be solving with some approach that we implementing in our transformation. Slide please. So an integrated health system increasing workload of healthcare worker, like you will see here, between maternal child health, immunization, nutrition, infection disease, they all have their own inputting data. They all have their startup data. So health facility are not integrated. One health worker need input 60 into 70 spread system, need to remember a lot of logins and password, and so they spend more in front of the computer to providing the service. It's not a good environment to make everything become more simple. So we will try to make a transformation to make everything become more efficient, more easier, and decreasing workload in our healthcare workers. Slide please. The problem is in health technology are spread across multiple health sectors like primary healthcare, secondary healthcare, pharmaceutical, medical device, health equipments, and human capitals, health financing, organizing, management, and biotechnology. All problems are spread across multiple health sectors. They have 70 applications per system. They have more than 10 applications per system. They're not precise and haven't fulfilled the information analytical needed. They're not fully integrated yet, and they don't seem and genome data government for fusion need to be enhanced. So we should make some analysis and try to make us have a good system to make it more as simple as possible. Slide. And the focus of digital health technology will shift us from reporting services so that all health facility innovated to create application technology system that best serve for the people who interact with them. That is our minister, Mr. Budi Sadikin, always say to us to make a transformation of digital health technology to be safe from reporting to services. And we have Minister of Health have committed to transformation, and we have 6 pillars of transformation. There are primary service transformation, secondary service transformation related to the hospital, health security system transformation. It's related with improving pharmaceutical and medical equipment sector resiliency and strengthening laboratory-based surveillance and resiliency emerging health response. And we also the pillar of health financing system transformation, and we have health human capital transformation, and the last one is health technology transformation that we are going to talking deeply today. Slide. So the Indonesian health transformation will integrate all health data with this life cycle basis approach and digitizing the health services. So in these years, we current progress, we already developed single health identify based big data system. We already integrated health facility information system development, and the expansion of telemedicine to support our infrastructure's transformation. In the next year, we try to implement of our artificial intelligence basis, the implementation of integrated health facility information system and artificial intelligence, blockchain, Internet of Things-based regulation sandbox implementation is very important. This should be due in the near future. And our next step will be more expanded cover the single head identify, expanding scope integrated health facility, and licensing expansion of health technology innovation. Slide. And integrated solution health system, we have Indonesian health services we call as Satu Sehat, that the Satu Sehat will be connecting all players within the health industry ecosystem like hospital, primary healthcare, startup, pharmacies, the health services, and laboratory, and etc. And we try to make integrated in health in system will provide specification and standardized mechanism for business process data and security, and we try to make developer have flexibility to use any programming language as long as they follow the specification and information exchange mechanism defined by IASS. So IASS number of the unique identified patient in a health information ensure continuous access to health facility. It will be connecting more than 10,000 primary health care, more than 5,000 general practitioner, more than 10,000 hospital, and also more than 11,000 clinical, and more for laboratory, and more than 30 key of pharmacies will be integrated in one application that we call as Satu Sehat application, Indonesian Health Services. Slide. And the health data integrated interoperability benefit patient by encourage data-driven policy making and easy access to personal health data with sharing and access in the all of states of health services like hospital, primary facility, pharmacies, and laboratory. They can, the patient can access what they are already done in their facility. It's not about only treatment, but also access the personal health data services, as we call our health in individual, that personal health data services. Personal health data stored in the citizen health application, it will be integrated in Satu Sehat data, and it data stored in the health data dashboard, and the health data dashboard will be access to public dashboard support driving policy making that we need in the future to decide it as well as possible to policy making in Ministry of Health. Slide. And development of citizen health application encourage the implementation of personal health services like medical resume, health promotion, medicines profile, health diary, hospital bed availability, early warning system, tracing and testing methods, integrating telemedicine and personal health education. Patient will have complete control over data stored at Satu Sehat. data cannot be stored in Satu Sehat and or accessed by IS without the consent of the patient is very important for confidentiality, and also patient can give their consent to the Peduli Lindungi application. Peduli Lindungi application, you know your customer solution to ensure data accurate and account ownership. So Satu Data, that the personal health services is very important in our transformation of data system in our Ministry of Health. Slide. So Satu Data Kesehatan provide region-based health data dashboard for database policy formulation. They will be integrated system in a facility of health, and they also integrated platform for data existing system, and they will integrate it with our Peduli Lindungi platform that we already have, and that system with from ecosystem Halodoc, Primaku, etc. will be integrated in the one of platform we call as Satu Sehat. The region-based health data dashboard is very important for national level dashboard, provincial level dashboard, city, district level healthcare, primary healthcare, village, and public dashboard. The data policies are starting from public relations. All data integrated with Satu Sehat it display in one health data dashboard, or system-related dashboard, and data analysis in the Ministry of Health are one in the hand data dashboard, and this data visualized display on the dashboard based on the priority of Satu Sehat use cases, and the one health data dashboard has access sharing up the provision the city regency has so far, so that this unit do not need to build their own dashboard system. It will be implementation as soon as possible based on our single startup of implementation in data storage. Slide. Ladies and gentlemen, Indonesian government supports the transformation of health technology generally through various regulation. We have already some law about some regulation about that, but Satu Data platform in the citizen health application data standardized and reset policy is the support of some regulation that we already have, and we already make to making this data will be have based on precisely a regulation in every part of the data architectures. Slide. So regulation support a medical record implementation. It will supporting the digital transformation. Health regulation support is needed to ensure transformation can run well. The Ministry of Health has made change update to regulation from previous misregulation become latest regulation, namely misregulation, the electronic of medical record regulation after 14 years. Slide. So the misregulation medical record update the governance of electronic medical record to make healthcare facility must implement it in the electronic medical record. Electronic medical record must be integrated with the Ministry of Health programs, and data and system standardizing must be followed of Ministry of Health regulation, and data management for health intervention and policy making should be integrated, and patient-referred health facility have access to electronic medical record data. Satu Sehat citizen health application data standardized and research policy is very important to make it in one regulation that we should make it in our regulation. So that is all that I can share to you today. I hope the information of ministry program will make our transformation in our startup data will make Indonesia bureaucracy more simple, more simply, and we have invite you to have some support of this plan, and in the near future we already have some regulation and some consolidation of the data in our own based on the needed of health needed for Indonesian people. Thank you so much for your attention and good afternoon.